Hi all, welcome to the new video. Today I'll be talking something about surfactant. What is surfactant? What do you mean by surfactant? Surfactant is a substance or an agent which reduces the surface tension. It's a substance that reduces the surface tension. Surfactant is secreted by type 2 pneumocytes, type 2 alveolar cells. In the alveolar, we have two types of cells. The alveoli consists of two types of cells. The alveolar cells are known as pneumocytes, type 1 pneumocytes as well as type 2 pneumocytes. The type 2 pneumocytes are the ones which secrete surfactant. So what is the importance of surfactant? Surfactant is required, it's a must, it's a mandatory thing which everyone has in their lungs, in the alveoli. It prevents the edema of the lungs, it promotes the alveolar stability, it promotes stability of the lungs, it reduces the work of breathing, it helps in preventing the edema of the lungs, it reduces the surface tension of the lungs mainly. And what is the surface tension actually? The surface tension, when you take an alveoli, on the surface of the alveoli we have many molecules of water. So the water molecules exerts a pressure there on the surface of the alveoli. So the force exerted there is known as surface tension. And the force is actually, it is the inward force. So what happens if the surface tension, the force exerted again and again, what happens? The alveoli gets collapsed. It gets collapsed. So to prevent this collapse of the lung, or to reduce the surface tension of the lung, we have an agent known as surfactant. So surfactant is a substance or an agent which reduces the surface tension of the lung. What does this surfactant contains? Surfactant is mainly composed of mainly two things. It is mainly rich in lipids. The major composition of surfactant is around 90% is lipids, whereas the remaining is majority of proteins, 8% of proteins, and negligibly or 2% you can see it is carbohydrates. So 90% of lipids, 8% of proteins, and 2% of carbohydrates are the composition of surfactant. The main composition of lipid, you can say 90%. In that lipids, the main thing is our lecithin. Lecithin or lecithin, the other term or the other name for lecithin, you can say it as dipalmitoyl phosphatidylcholine, DPPC. So lecithin or DPPC, dipalmitoyl phosphatidylcholine, are the major constituent of our lipids which is present in the surfactant. So dipalmitoyl phosphatidylcholine, DPPC, for lecithin. Then we have something known as sphingomyelin. Then we have something known as phosphatidylglycerol and phosphatidylserine. So the main composition is in the lipids is lecithin as well as sphingomyelin. And we also have phosphatidylglycerol and phosphatidylserine. So in proteins, coming to proteins, we have something known as SP, surfactant proteins. So surfactant proteins can be SPA, SPB, SPC, SPD. Among this, SPA and SPD provides the immunity to the lungs. Okay, it provides the immunity mainly SPA and SPD. Also, we have proteins known as albumin. Also, we have something known as IgA. Immunoglobulin A is also present in the protein part of the surfactant. And the other 2%, the remaining is carbohydrates. So composition of surfactant mainly 90% is lipids, 8% is protein, 2% is carbohydrate. In lipids, we have lecithin, we denote it as L, sphingomyelin S, and phosphatidylglycerol and phosphatidylserine. In proteins, SPA, SPB, SPC, SPD, and albumin as well as IgE. Then we have 2% carbohydrates. This is the composition of surfactant. When the surfactant is synthesized now, actually surfactant is synthesized in the late part of the pregnancy. You can tell it as a third trimester, like after 28 weeks. From 28 to 34 weeks, it's a time where the surfactant synthesis appears. Surfactant appears to be synthesized. But it is around 70 to 80% is synthesized. It's around 70% is synthesized. It becomes around 90% is synthesized in the 38 to 40 weeks of pregnancy. And it continues to go on. Synthesis continues to take place even in the perinatal life. So the synthesis begins at the week from the 28 to 34 weeks of gestation. And when you take a type 2 pneumocyte, when you see in the microscope, how does it look like? It looks as of a storage bodies. It looks in the form of storage bodies in the microscope. When you take the type 2 pneumocyte and we focus, we see as a storage bodies. So it is known as lamellar bodies. These storage bodies, what you see is considered to be the lamellar bodies. Lamellar bodies is easy. It's also known as counting bodies, what we see in the microscope when you take a type 2 pneumocyte. So these lamellar bodies, later it is converted to something known as tubular myelin, TM, tubular myelin. And this is later, it is in the form of the lipid layer, the surfactant, what we see in the alveoli. So it is in the form of lamellar bodies. That is what you have to keep in your mind. So the period of gestation, as this starts around 28 to 34 weeks of gestation, and then it continues to happen in the later part, 30 to 40 weeks. Again, it continues to happen in the perinatal life. During the delivery also, it continues to happen. So, and it's in the form of lamellar bodies, what you see when you focus on the microscope. So now, what are the functions of surfactant? So main function in the definition as well, we told earlier, this definition is that the main function is to reduce the surface tension. It reduces the surface tension. It prevents the surface, it reduces the surface tension. It prevents the edema of the lungs. It prevents the edema of the lungs. It promotes alveolar stability. It provides immunity, mainly the SPA and SPD provides immunity. It increases the area of the alveoli. It increases the area of the alveoli by increasing the radius of the alveoli. But you can remember the equation as area is equal to pi r square. So it increases the radius of the alveoli, thereby increasing the area of the alveoli. It reduces the work of breathing. It promotes phagocytosis. Surfactant promotes phagocytosis. It prevents edema of the lungs. It prevents collapse of the lungs. So it's a very important thing. That's why surfactant is very, very important. What happens when there is a deficiency of surfactant? There is a defect in the synthesis of surfactant. There is a deficiency of surfactant. It leads to a condition known as hyaline membrane disease. HMD, hyaline membrane disease. It's also known as infant respiratory distress syndrome, IRDS. So HMD, hyaline membrane disease or infant respiratory distress syndrome is due to the deficiency of the surfactant happening. It usually occurs in premature babies. It usually occurs in the gestational diabetic mothers. Okay. The mother who is having gestational diabetes is more prone for surfactant deficiency, which leading to a condition known as hyaline membrane disease or IRDS. So it happens in premature babies. The lung can be collapsed. So what can be done here? You can give inhalation of glucocorticoids, exogenous inhalation of the exogenous surfactant can be given. The glucocorticoid therapy can be given. So why it is? Because the agents that increase surfactant, there are the agents that increase surfactant. One is mainly the cortisol. Glucocorticoids can increase the surfactant. The other one is T3, T4. T3 and T4 thyroid hormones can increase the surfactant. The agents that can decrease surfactant is hyperinsulinemia. Hyperinsulinemia, what happens? It blocks the cortisol action. So thereby it decreases the surfactant synthesis. Okay. So as a treatment of hyaline membrane disease, you can give cortisol and glucocorticoids can be given. Exogenous surfactant can be given. Inhalation of the surfactant can also be done. Phospholipid inhalation can also be done. So that can be the treatment of infant respiratory distress syndrome and hyaline membrane disease. So this is a few important points of surfactant. And what earlier I told about lecithin, L and sphingomyelin in the composition of surfactant. What is the importance of that? LS. L is to S ratio. Lecithin is to sphingomyelin ratio. L is to S ratio should be more than or equal to 2 to assess the fetal lung maturity. So you can assess the fetal lung maturity by knowing the lecithin value as well as the sphingomyelin value. So L is to S ratio should be more than or equal to 2. How can you do the test? What are the tests can be done to assess the fetal lung maturity? So LS ratio can be done by, for example, if you take a test tube. In the test tube, you take amniotic fluid and you shake the test tube. So if you see bubbles in that, means the lipids can form the bubbles. So if you see bubbles in that, that means it is the presence of surfactant is there. So LS ratio is to assess the fetal lung maturity. You can do a test, take a test tube and fill with amniotic fluid and shake the tube and see for the bubbles present on that. So lipids, because of surfactant, if it is present, it forms bubbles. So it is known as, this test is known as shake test. Shaking the test tube, shake test or bubble test. So forming the bubbles, bubble test. Or it's also known as Clement test. CLEMENT, Clement test. Clement was the one who have introduced this test. So Clement test or shake test or bubble test. So this LS ratio is very important to assess the fetal lung maturity. So these are some of the things which we have to remember about surfactant. So ultimately surfactant is an agent which reduces surface tension of the lungs. Thereby it prevents the edema of the lungs, prevents the collapse of the lungs, it promotes alveolar stability of the lungs, decreases the work of breathing, it increases the area of the alveoli, it promotes phagocytosis, it provides immunity. So these are all the functions of surfactant. If surfactant is deficient, it can lead to a disease known as hyaline membrane disease or infant respiratory distress syndrome, which you can be treated by which is mainly caused in gestational diabetes mothers in premature babies. You can give glucocorticoid as a therapy or inhalation of phospholipids, mainly exogenous surfactant can be given. So this is all about surfactant. Surfactant is an important aspect what you should know in the mechanics of breathing in the when you study of mechanism of respiration, surfactant is the one which helps in promoting the alveolar stability of the lungs, preventing the collapse of the lung. That's all about this video, surfactant. Thank you all. Thank you.